Why is it not advisable for patients to use medications like antidepressants or medications for anxiety and for sleep to induce sleep in the brain? And the reason we always advise against that is because these chemicals that you put in the brain actually they already exist in the brain. But what you do when you take medications, that you increase one of them at a time to a level that's unknown. As we know, the brain works on equilibrium. Therefore, the whole goal is to maintain that balance of the key chemicals, particularly the ones that are involved in anxiety, depression, ADHD, and sleep disorders, because those are the most common psychological disorders that we see in patients nowadays. Now, what are those neurotransmitters that we're talking about? What are those chemicals? One is serotonin, which is a chemical responsible for making you feel good and happy. Two is dopamine. This is the driver in the brain. This is the one that stimulates your drive, your passion, your goals, and that just makes you feel achievements, makes you drive towards getting something that you own or achieving a goal. And thirdly is norepinephrine. Norepinephrine is responsible for regulating our alertness or sleep as well. And the fourth neurotransmitter or chemical is called GABA. Now, GABA is almost like the braking system in the brain. So when you've got all these excitatory neurotransmitters or chemicals that create stimulation and excitement in the brain, GABA is the one that actually brings everything back to control. And this is what we mean when we say equilibrium and balance in the brain. Some of them are excitatory, which means that they excite the brain, they stimulate, and others sort of bring the brain back to normal, creating this balance, this equilibrium that is so essential to functioning and feeling good and just being a normal functioning human being. But now, what happens when you struggle with a condition like depression, for example? Often we will go to the doctor and the doctor will prescribe an antidepressant, or a psychiatrist will prescribe an antidepressant. But what exactly is an antidepressant? An antidepressant is called an SSRI. What does that mean? It means selective serotonin reuptake inhibitor. As the name suggests, it inhibits the reuptake of serotonin in the brain. What does that mean? It means it stops the reabsorption of serotonin in the brain. Now, why is this a problem? It's a problem because the brain works on connectivity. The functioning of the brain works on connectivity. It relies on neurons in passing these chemicals called neurotransmitters throughout the brain. So one neuron, which consists of neurotransmitters, chemicals in it, will fire out a neurotransmitter, which is a chemical. It'll fire it. There's no connections. It fires it through the synapses in the brain, and it goes into the next neuron, where the next neuron reabsorbs it or reuptakes it, and then passes on to the next neuron. And so it goes on throughout the brain. This is what we call brain connectivity. Now, when you take an SSRI, you stop that function. So this one neuron, which contains serotonin in it, will fire serotonin out. However, this one will not reabsorb it, because this was designed to flood your brain with serotonin to make you happy. Does this work? Yes, it does work. It actually does lift your mood. There's only one problem with this, is how it works. As I've explained, this is problematic because you've stopped a brain function. So you've stopped the passing on of serotonin throughout the brain. This is problem number one. You've stopped a brain function. Now, what does it mean? Why is it a problem? It's a problem in that when you stopped the rest of the neurons in the brain from reuptaking and reabsorbing, it takes a while for the brain to relearn to start the process again. So you become dependent on these antidepressants. So now you will never feel happy without taking your antidepressant. This will become a lifetime issue, because every time you don't take your antidepressant, your brain's neurons still don't know to reabsorb and reuptake and pass on serotonin throughout your brain to make you feel good and happy. So what does the brain do? It stops doing what it's meant to do because you're feeding it serotonin. And this works with all medications and with all drugs. In any type of drug or medication or anything that you're putting into your brain, it works in the same way, in a similar manner. Another problem with taking medications for psychological disorders is that you don't know what the constituents of these 4 chemicals that I've just listed is in your particular brain at that moment. And this is why you'd often hear psychiatrists and doctors would say, all right, we'll start you off with 5 milligrams of this medication, for example. That's because they don't know what levels these neurotransmitters are at in your particular brain. And then they'd say, well, if you don't feel well or if you don't feel any better, come back in a month's time and we'll increase the dosage to 10 milligrams or 8 milligrams. And as we know, with any drug or anything that you take, eventually you reach an optimal level where you need more of that in order to have the same effect. So in other words, you need more of the drug in order for you to feel good. You need more of the antidepressant, or you need a stronger antidepressant in order for you to still feel okay. And this goes on, and you end up with 20 milligrams, 50 milligrams. When that doesn't work, they introduce another SSRI or another antidepressant, and then you become addicted to these drugs because you need more and stronger, and you're taking them for much longer, a longer period of time, making you reliant again on these medications, when your brain actually already has these chemicals in itself. And the only way to do this correctly is to stimulate these neurotransmitters in the brain, because the brain can never have too much of a neurotransmitter. The brain's whole goal is to keep balance and equilibrium of these chemicals. So it knows how to regulate and to keep these chemicals in balance. But when you start to interfere and feed it with one neurotransmitter, you don't know what levels the others are. You don't even know what levels the neurotransmitter that you're trying to supplement is at in your particular brain. The third problem with medicating the brain is that, lastly, the most important part, or the most important problem or issue with medicating the brain is that, particularly with depression. And the one other important issue with medicating the brain is that there are 4 neurotransmitters, as I've already mentioned to you, that are crucial to maintain balance in the brain. So when you take an antidepressant, all these other 4 neurotransmitters work together. They are all essential in depression. So when you take an antidepressant, you are only solving one problem, a problem with one neurotransmitter, which is serotonin, because you are taking a selective serotonin reuptake inhibitor, which is an SSRI, which is an antidepressant. That is the method that is used to flood your brain with serotonin. So your brain will then have an excess of serotonin. But there are other 3 neurotransmitters that are very important. As we know, when people are depressed, they often lack norepinephrine, which I mentioned is responsible for alertness and regulating sleep. So you'd often see when people are depressed, they either sleep too much or they struggle with insomnia. And both are indications of depression. So when they sleep too much, they have no goals as well. They don't want to wake up. They're not interested in creating any goals. They're not interested in waking up and going to work. They're not interested in doing or initiating anything. And that is because of the depletion of dopamine, which is another very important neurotransmitter. And as I mentioned, GABA is equally important, because GABA is the one that actually brings the brain from revving up with all these stimulating neurotransmitters or chemicals, and GABA brings it back down so that your brain is able to relax and you're able to go back to sleep and be in a calm state. Now, we need all 4 of these neurotransmitters to be in equilibrium, because when you then take an antidepressant, you're only spiking one of these neurotransmitters. Now, what's the problem with spiking one of these neurotransmitters, other than the fact that you're not dealing with the condition? you are not actually solving the depressive symptoms. You are not aiding the patient or yourself, if you are taking it yourself. The patient's depressive symptoms don't subside because you haven't dealt with the other neurotransmitters that are quite important. The dopamine, which is responsible for driving, getting the patient to wake up and actually go and find a goal and do something, go to work, do what they need to do, engage in activities that they enjoy. You also have a problem with the patient doesn't sleep very well. And when the patient doesn't sleep very well, you often see that they will always be depressed, because you need sleep. Sleep is also crucial in depression in that sleep allows memories from short-term store to move into long-term store, which is why people always say, if you're studying for an exam, you need proper sleep. This is what they mean. Because if you don't sleep well, you cannot move memories into long-term store. And if memories don't go into long-term store, they remain in your short-term storage. That means that you're constantly regurgitating the same memories, and therefore you are feeling depressed continuously still. So that's because you haven't slept. That's because of a shortage of norepinephrine. So you can take an antidepressant. If norepinephrine is not corrected, you're still unable to sleep and you will remain depressed. If dopamine is not corrected, you're still lacking drive and you're still lacking motivation, which is what you require, because as we know, when you reach a goal, you feel good about yourself, and you can't be depressed because you're excited about a goal that you, or something that you created and a goal that you've achieved. So as you can see, all these neurotransmitters work together in tandem. And if they're not, and there isn't a pill that takes all of them to the same level that they should be at. And this is what's problematic about medications for psychological disorders. So please be aware of these medications. Google the medicine that you've been given, look it up and see what it is and understand what it actually does to the brain. Lastly, as we know, the 4 neurotransmitters need to be in balance. What is wrong when they're not in balance? We then see the side effects of the medication that you're taking. Because if you're spiking serotonin, or you're spiking dopamine, or you're spiking any one of these neurotransmitters, that means the brain is not in balance. And the side effect of that is what we often see when patients are, for example, patients who take ADHD medication or anxiety medication often also need to take a sleeping pill, or they often also need to take antidepressants, because you'd find that depression also is a side effect of anxiety, of the anxiety medication that they're taking. So now you find a pattern where a patient started off with anxiety, for example. Now they are on anti-anxiety medication. They're also on antidepressants because they've developed depression along the line, or they initially started off with depression and they now have developed anxiety symptoms. So now they're on medication for depression, they're on medication for anxiety, and when that happens, you almost synonymously are also starting to have sleeping disturbances or sleeping patterns that are disturbed, or sleep disorders. And now you need to be on a sleeping pill. And it becomes this vicious cycle where patients are taking so much medication and they are creating the symptoms, and at the same time simultaneously trying to treat the symptoms but creating other symptoms at the same time. And this is what's problematic when you start to interfere with the brain chemistry. So please be aware. Google the medication you are on, understand your condition, and find out what alternative methods are that are natural, that can help you reach the same sort of effects that medications can do. Medications are a shortcut. There are other methods where you can stimulate your brain naturally and get these chemicals or neurotransmitters at levels where they should be. And as said, the brain is able to regulate what levels these neurotransmitters should be, so that you don't have side effects or symptoms of other conditions that you begin to have when you interfere with your brain chemistry.